If you find that you've been diagnosed with lumbar stenosis, please don't think the world has come to an end. There are many things that you can do conservatively that can help to decrease and potentially even eliminate all of your leg pain. So first of all, I want you to consider this. Stenosis means that the holes in the spine have narrowed. We have ways of opening them. Number one is what we want to do when we stand is create a flat back posture. Find a physical therapist that can help you to create intrinsic stability and use pelvic tilt, not as an exercise, but as a skill to open the holes and create more space for the nerves in your lumbar spine. Second, find a physical therapist that will help you to increase what we call hip extension. Very often, due to jobs of sitting or a relatively sedentary lifestyle, we tend to get very tight in the front of our hips and we actually lose hip extension motion. So find a physical therapist who will help you gain 10 to 15 degrees of hip extension so that every step you take does not create a closing down or extension load in the lumbar spine. When that happens, when you have a loss of hip extension, you can actually decrease the space in your spine by about 50%. Think also about finding a therapist to help you increase your arm elevation. As I raise my arm, if I have stiffness in my shoulder or my shoulder girdle, it's going to also create an extension or a closing down of the holes in the lumbar spine. So threefold. Can you achieve a flat back? Do you have enough hip extension? And do you have enough arm elevation? Don't try to force this on yourself because it will just repeatedly narrow the hole. Find a good manual therapist to help you gain this in a pain-free and successful way.